Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I think we will start. I just wanted to give brief introduction. I'm
Mm-hmm.
Dr. Alpana Kondekar. I'm
Yeah.
associate professor and I look after pediatric neurology in Nair
Mm-hmm.
Hospital. And we do have one dedicated pediatric neuro rehabilitation center where we
Mm-hmm.
have complete refractory epilepsy setup. So with this
Okay.
brief thing, I think we'll proceed with the whole thing.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, so in the brain we have tiny cells called neuron, and these neurons are necessary for all the functions and signaling and transferring the messages in the brain, which are responsible for the way we behave, the way we think, and the way we act. So when these neurons they
Yeah.
throw a electrical signal at a time synchronously, that is together, there is a kind of storm that is created in the brain, and this storm is responsible for the change actions, change movement, and
Mm-hmm.
the way we perceive things, and this is called as
Yeah.
a seizure. The seizure can manifest in many ways, like it can be behavioral change, it can be autonomic change, it can be change in the movement, etc. So that is the electrical seizure in the brain,
Mm-hmm.
and the manifestation of a seizure is in many different ways.
What is epilepsy?
Okay, so there is a difference between seizure and epilepsy. When
Mm-hmm.
any person gets two different seizure on two different occasion, which are
Yeah.
unprovoked. Unprovoked means which are not exactly stimulated or caused by anything else. So these
Mm-hmm.
two unprovoked seizure coming in any individual, we call it as a epilepsy. In short, if the seizures are coming at repeated interval, it is called as a epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, so depending upon how the brain is showing this seizure activity, so there are focal seizures, there are generalized seizures. So focal seizures are originating from one particular part of the brain, while the generalized seizure is originating from the complete, or the entire brain. Now, depending upon which part of the brain the seizure is originating or the electrical discharge is increased, the
Yeah.
manifestation is different. Like sometimes it will be only movement of one particular limb, sometimes it is a movement of all four limbs, or in our brain per se is responsible for many functions, right?
Yeah.
Emotions are thinking, then there are certain parts of the brain which control movements, which is also called as a motor area. So if seizures are in originating from one of these parts, the manifestation of seizure will be accordingly, like the area which control emotion, if the seizure is originating from that particular area, you might
Yeah.
see some change in behavior and etc. Okay, so there are different type of seizures depending upon which part of the brain they are originating, or whether they are originating from entire brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, there is not always the cause is been found in epilepsy cases. Now,
Mm-hmm.
epilepsy in children and epilepsy in adult is very, very different. Some
Yeah.
common causes of epilepsy are infections in the brain, then certain tumors,
Yeah.
head injury, certain
Mm-hmm.
toxic. So these are common causes. But in children, the genetic causes are also there. Genetic causes is much more common. Metabolic
Mm-hmm.
causes are also common in pediatric patients. While in adult, some diseases like stroke, Alzheimer's are responsible for epilepsy. So, depending upon age group, the causes are different.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. So, as I told you earlier, depending upon
Mhm.
which part of the brain the seizure is originating, the
Yeah.
manifestations are different. So there are
Yeah.
five different type of manifestation. One is motor manifestation, where the movements are seen predominantly abnormal movements. So these abnormal
Mhm.
movements can be jerking of the limbs, can be tightening of the limb. Okay, in
Yeah.
behavioral changes, the children or the adults who are suffering from this type of seizure may have screaming or inappropriate talk or the feeling of fearfulness, etc. Then there are some sensory seizures where they can feel some tingling numbness in one particular limb which is coming very periodically, and sometimes it is just a sensation of feeling giddy, or feeling as if everything is revolving. Sometimes
Yeah.
the flashes of light which are seen, so it can manifest like anything. So what we usually, in simple language, we tell patients that faints, like fainting attacks, okay, staring attacks where eyeballs become very fixed
Yeah.
and the child is unresponsive or the adult is unresponsive, and funny turns or funny movements are the main presentations where the caretaker should alarm that it can be a seizure. So change in movement, change or
Yeah.
change in perception, and sudden
Mhm.
inappropriate change in emotion and sensations are some important warning signals.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, thing is that as I highlighted, that it can present with
Yeah.
different types. Like most of the people have misunderstanding that seizure or fit, or what we call it in Hindi, mirgi, or epilepsy, is presenting only with motor movements, that is jerking of the limbs and jerking of the entire body or tightening of the body with uprolling of eyeball. But that is not really the scene. It can present in various different ways, and because of this, they do not understand that this is only originating from brain. For example, those patients who are having behavioral changes as part of the seizure,
Mhm.
nobody will understand that this is originating from brain and it is not in the patient's control. They will think that he is behaving in very unwanted manner or inappropriate manner. So because of
Yeah.
this, and earlier there was a myth and belief in patient that epilepsy, in fact, that seizure terminology has had come from the Greek word seize, means to capture, to captivate. So many
Mhm.
people, when such kind of funny seizures are there, they feel that the child or the adult is suffering from either some psychiatric illness or some, some supernatural power has captured. So such myths are there, and because of that there is a stigma also, because lots of patients who are having repeated seizures, they are discriminated by
Mhm.
people at school, at workplace. They are not involved in active work, and
Yeah.
they are discriminated from other normal children or normal adult. So this stigma is always there because of lots of disbeliefs and myths.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay, so the important seizures triggers in children and adult are different. So I'll narrate both. So in children, the important
Yeah.
trigger is very common trigger is fever, and very commonly till
Mhm.
6 years of age, the seizures can come during the febrile episode. So avoidance of fever treatment of fever immediately. Keeping some emergency medicines for fever at home is one important
Mm-hmm.
step in managing febrile seizures in children. Then some triggers in adult are missing of meal, so remaining fasting for long time. Secondly, excessive stress. Then missing or inadequate sleep. So these are some common trigger in adults. Alcohol abuse or drug abuse is another reason, and sometimes some epilepsy types in adolescent age group, they are called as photosensitive, means they are triggered by flashes of light. So nowadays, because of excessive use of digital media and social media, so playing computer games for prolonged time, watching TV from very close distance, playing on mobile
Yeah.
for long time also can trigger seizure. So these are important trigger seizures.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Okay. So there are two important things when we come to the management. One is compliance of the treatment, and second, lifestyle modifications. So I'll first
Mm-hmm.
discuss the compliance regarding the treatment. So it is very, very important that drugs or medicines are
Yeah.
prescribed for epilepsy has to be taken
Mm-hmm.
regularly, on time, and exactly following the given instruction, because any change in the formulation of the medicine, change in
Mm-hmm.
the dose of the medicine, and
Yeah.
missing out the dose, as well as changing the brand, even of the medicine, can
Mm-hmm.
still trigger a seizure. So that is one important thing. Second
Yeah.
advice from my side, as please stick to your one particular physician who is treating you for epilepsy, and do
Mm-hmm.
not do doctor shopping, like switching to one or more consultants, because
Yeah.
every time when you are approaching a new consultant, there is a change in medication, change in the approach how the epilepsy is treated, and that may also trigger seizure. So this is regarding the treatment. Never
Got it.
stop medicines on your own. Please consult
Mm-hmm.
your doctor. Another important advice is during acute illness other than epilepsy, for example,
Yeah.
febrile episode or simply diarrhea and all, do not
Mm-hmm.
stop the medicines. And if you are taking any other stronger medicine, please consult your doctor, because there may be some drug interactions. So, this is regarding the treatment. Other lifestyle modifications are those who are on anti epileptic medication should
Yeah.
avoid taking inadequate sleep, missing their meals, taking
Mm-hmm.
excessive stress. There are certain sports, like for physical activity, epilepsy is not a contraindication. Physical activity can be done in child or adult with epilepsy, but there are certain adventure sports like hiking,
Mm-hmm.
trekking, going on bike. So all
Mm-hmm.
these need to be controlled or curtailed, and swimming can be done, but for swimming there has to have some person who is continuously supervising inside the pool, not the outside pool, inside the pool. Even for
Right.
driving, those adults who are on anti-epileptic medication, if
Mm-hmm.
there are no seizures for around 6 month period, they can do driving, but there has
Mm-hmm.
to have somebody in the car, and they should not drive alone. For small children, cycling is allowed, but cycling
Mm-hmm.
should not be done on the road with busy traffic. So these are certain, small lifestyle modification, and
Yeah.
certain things to ensure the compliance in epilepsy are very, very important in adequate management.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. So here again, I will like to talk about children as well as the adult. So for
Mm-hmm.
children, there are certain type of epilepsy syndrome where they get very rapid head drops, and this can injure the child repeatedly. So
Yeah.
it's there is one particular epilepsy type where we call it as a LGS. So in those
Mm-hmm.
patients, we offer a soft cushioned helmet to be worn everywhere, at home as well as in the school. So that is one important thing. Then in the house where children with epilepsy are there, the medicines has to be stored and keep in stock even for emergency. There are certain emergency drugs available like nasal spray and all has to be kept at home. When the child is conversing actively, please do not put anything in the mouth. Do not try to open the mouth forcefully. Do not put any medicine in the mouth. It is very important. For even for adult, if the adult is conversing actively, it's very important to keep
Mm-hmm.
or make lie that child or adult in a safe position or on the ground in a left lateral position. Left lateral position is most safe position because we do not want their saliva and other secretion to block their airway. So left lateral position is very important. Then if they are wearing the tight clothes, please loosen them. Do not crowd around.
Yeah.
Sometimes the seizures they are self-limiting, so they can just go off in 2 3 minutes. If
Mm-hmm.
seizure lasts for more than 5 minutes, then it is important to take the patient immediately to hospital and call for ambulance. Also, at home, do not keep any sharp objects and sharp edges of the furniture. Please cover them because that may cause injury. For a patient who are getting sudden seizures, please avoid using glass utensil because it may break and injure. So these are small safety tips which has to be followed at home.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.